Xin chào các bạn, Emmi đây. Đây là một video clip rất đặc biệt và rất ý nghĩa. Tuy nhiên Emmi sẽ phải mở đầu video clip này bằng những câu chuyện không được vui cho lắm. Đó là câu chuyện về cá nhân của Emmi. Bố của Emmi thì đã bị mất vì ung thư cách đây hơn 3 năm. Và một người bạn thân của Emmi cũng vừa mới phải chiến đấu với ung thư máu. Một người bạn lâu năm của Emmi cũng vừa mới phát hiện ra mình bị ung thư vú. Và có rất nhiều những người trẻ tuổi bằng cách này hay cách khác có liên quan đến Emmi cũng đang phải chống chọi với căn bệnh ung thư, đặc biệt là ung thư vú. Và ngày xưa ấy, thì chúng ta cứ nghĩ rằng là ung thư là căn bệnh của người già, là khi gần đất xa trời. Có lẽ Emmi nghĩ là bây giờ chúng ta sẽ phải rephrase, nói lại câu nói này. Đó là kể cả người trẻ cũng có thể gần đất xa trời vì ung thư. Đấy cũng là một lý do mà Emmi và Happy Skin quyết định làm video clip này, bởi đã đến lúc là chúng ta sẽ cần phải nhìn nhận lại và chúng ta nghĩ rằng là ung thư, đặc biệt là ung thư vú, không chừa một ai cả. Chúng ta cần phải chuẩn bị tâm lý và kiến thức trước căn bệnh này và đừng tiếp tục làm ngơ nữa, vì nó không còn là chuyện của nhà người ta. Bất kỳ lúc nào nó có thể trở thành chuyện của nhà mình, giống như là điều đã xảy ra với các Emmi cách đây 3 năm. Và Emmi chưa bao giờ mà thực sự là kêu gọi mọi người phải chia sẻ nhiệt tình một video clip nào của Happy Skin cả. Nhưng mà với video clip này thì Emmi hy vọng rằng là mọi người hãy chia sẻ, bởi vì đây chắc chắn là một video clip rất là hay và với những kiến thức cực kỳ là chính xác và bổ ích. Nên Emmi hy vọng sẽ có càng nhiều người xem video clip này càng tốt. Cảm ơn mọi người rất nhiều. Và bây giờ thì chúng ta hãy cùng đến với một nhân vật rất đặc biệt ở trong video clip này. Hi, Dr. Basma.
Hi, Emmi.
Thank you so much for accepting the invitation.
It's my pleasure.
You know, the reason why we have this video, because like nowadays in Vietnam, more and more young people got cancer.
Yeah.
So it's a very sad, but that's a fact. And we want to give the audience more information about cancer prevention and cancer care, so that they got more knowledge and protect themselves.
Yeah, you got a good point in there. There are more and more young patients getting breast cancer, and the idea is that we don't really think about breast cancer whenever we are meeting a patient that's got a breast problem. So we would think about infection, we would think about lots of stuff, but we wouldn't have in mind breast cancer. And this may lead, unfortunately, to some late discoveries. So the patient, whenever she's feeling something in her breast, as far as she's young, she wouldn't think about breast cancer as a possibility. And doctors too cannot think about the breast cancer whenever they are in front of a young patient. But this unfortunately is not true, and young patients are at risk of breast cancer, and we should avoid, by making this quite known, to avoid the late diagnosis in these young patients of breast cancer.
Yeah, that's a sad fact, right?
Yeah.
But we have to change it. That's the reason why we have a bulk of questions for you today.
Yeah, it's my pleasure. I'll try to give the ideas or the information I've got from the latest scientific data we've got. And the idea is to keep updated all the time. So what is true today may be not true tomorrow, but I will give you the information that are true for today.
Thank you. And are you ready?
Yeah, sure. So let's start by what is cancer. Every day in our bodies we've got cells that are multiplying. Whenever we have a wound, then we will have cells of the skin that would multiply in order to heal this wound. Whenever we lose peeling with our skin, we've got a new skin there. So our body is all the time multiplying cells in order to replace old cells or dying cells. Whenever we have cells that are multiplying without the body asking them to multiply, this makes a lot of cells multiplying, and this creates a tumor, which is cancer. So why do these cells multiply? It's because their DNA, their internal program, is getting impaired. So they start multiplying a lot and they create tumors. They get into the breast, they can get to the lung, they can get anywhere. So whenever we have cells that are multiplying abnormally, then they give tumors, and whenever these tumors are coming in the breast, then it is breast cancer. Afterwards, these cells would grow bigger and would go into the lymph nodes or would go into the blood, which gives, this is essentially why any cancer is dangerous, because it is able to send the cells elsewhere in other organs that are vital, and this is a severe disease. Oh, thank you, Emmi, for asking me this question, because I think it's a very important question. Breast cancer is, like all cancers, a big question about the type of cells, but also mainly about the stage. So early stage breast cancer is definitely curable. And whenever we are doing detection for breast cancer, we are pushing the ladies that would be at risk of breast cancer to detect it early, because definitely an early stage breast cancer can be cured. Late stage breast cancers are at higher risk of not cure, but we still can treat. But curing breast cancer for early breast stage cases is definitely possible. Yes, so one major point about breast cancer is that it is a quite difficult disease. That means it's a very complex disease. There's not one reason that would give breast cancer. This is very important to understand, because this is a different kind of disease. You know, whenever we have infection, whatever infection, we have tuberculosis, then we know what is responsible for this disease. It's one germ, we treat it and we are cured. Breast cancer is something that is quite complex. It's not a monofactorial disease. There is not one factor that would give this disease, but several factors together. So yes, genes do matter, but I mean not every woman. It matters first because we are women because of our genes. So we have more breast cancer because we are women. So for sure, the genes do have an impact. Family history with genes, yes, it has an impact, but these are few cases of breast cancer. The majority of people getting breast cancer do not have any family history of breast cancer, and this doesn't hold them from having the disease. So genes matter, but in a few cases, but environment, lifestyle do matter a lot. We don't really know why people are getting breast cancer. So we would take thousands of women that have breast cancer and try to search what do they have in common. So we find that there are points that are in common for risks to be at risk for breast cancer. So there are environmental characteristics, there are genetic characteristics, and there are lifestyle characteristics. So I will go back a little bit, so that there are environmental factors, genetic factors, and hormonal factors. So first, breast cancer is more frequent in women. We do have two breasts, so it's more frequent in women. And the second thing is hormones. Whenever we have a long exposition, natural exposition to hormones, that means early puberty and late menopause, then we are at higher risk of breast cancer. The second thing would be the substitution treatment after menopause. It could also increase the risk of breast cancer. For the same reason, it increases the exposition of our body to hormones. A big part of the breast cancer are responsive to hormones. That means they use the hormones to grow bigger. So this is why whenever we have a long exposition to hormones, we can increase the risk of breast cancer. Environmental factors would be the hormones we use for substitution after menopause, but one thing is very clear now is that consuming alcohol in a significant way is also a risk factor for breast cancer. The other risks would be would be the family history of breast cancer, sometimes no childbearing or late childbearing, but these are the main risk factors for breast cancer. This does not mean that anyone that has early puberty and late menopause will have breast cancer, not at all. This means that people that have these risks should adapt their screening. Deodorant. So the idea with deodorant is the geographic proximity to the breast. So what we know is that the use of some substances in deodorant or in any other cosmetics are not good for our health. We don't have exactly data that would say that deodorant would give breast cancer, but what we know is that the additives in some deodorants and some heavy metals, some paraben and some stuff like that would give a higher risk. This doesn't mean anyone using these deodorants will have breast cancer, but as we said before, we have a disease that is multifactorial, so it's not deodorant that giving breast cancer, it's maybe the use of some substances, harmful substances, with some history, with some family history, with some environmental exposure to hormones would increase the risk. One thing I know, maybe I'm not sure that deodorant can give breast cancer, but I am sure that we can avoid the bad kinds of deodorants. So using organic stuff or substances that are not harmful for the body are anyway good. So we don't know it all about breast cancer, but I know that if ever it is a risk factor, then it's easy to avoid. So let's avoid it. So this is, on the other hand, something that is proved scientifically. We know that ladies that do consume alcohol significantly do have a higher risk of breast cancer. For smoking, it's for sure playing a role. If not for breast cancer, it's playing a role for lung cancer and for head and neck cancer. So for sure, these two substances consumption are to be avoided if possible. So I was asked this question in Vietnam. Nobody has asked me this question before. So I went to seek for that and I found no scientific data saying that tight bra would cause breast cancer, but I think that comfortable situation on a daily basis is something that is important for our body, for our energy flow, so I think anything that would make our organs, whatever organs they are, uncomfortable is to be avoided. So no, of course not. There is 1% of breast cancer that is for male. So 1%, that means if you have one room of 100 patients for breast cancer, then one of them will be men. So whenever men have breast cancer, this have a big significance because it's a genetic disease at that time, and it has more significance than any genetic situation. So if you have a member of your family that is male and that had breast cancer, then that means that very likely there is the gene mutation in the family. So this is very important to be tested as a sister or a brother of a male patient that has breast cancer. That makes the risk much higher. Home screening is extremely important because this is a kind of screening you can do yourself and all the time. But it suggests that there is a learning curve of home screening. So how to palpate the breast, when to palpate it, and how are we supposed to use this palpation. So the breast is like a target with a nipple inside. So you would cut your breast in 4 four quadrants, 2 upper ones and 2 lower ones. And you would have to put your hand with your tip of your fingers in the nipple and try to palpate your breast quadrant by quadrant with your hand. And end up by following the breast till the armpit and palpate if you can feel anything. Of course, the first times you will palpate your breast, you will feel many things. You would feel the gland. That's very normal. Inside the breast, we've got some fatty substance, but it's got in it a gland that you will palpate. But while palpating each month your breast, you will end up by coming to know your breasts. How do they feel? And if one day while palpating your breast you will feel any lump, anything new, or a shape of your nipple that is not the same, or something in your armpit that used not to be here, then at that time you would feel a difference in your breast and you would have to go and see your doctor. When to palpate? So whenever we are having the periods, it makes the breast kind of a little painful, so you better avoid this period and start to palpate the breast around a week after the periods or 10 days. This is the best period to palpate the breast and see how do they feel. So this is your home palpation. So for screening, it is something different. These are imaging we would do to the breast, ultrasound or mammography, and for special cases, MRI. This is to be done at a frequency, for sure, not more than once a year. And for the remaining, each 2 years, it depends on your personal history, on your personal risk factors. So I would advise that with your gynecologist you discuss about any family history, about any hormone exposition, or about any risk factors we have talked about before, in order to agree about a schedule for your screening and which means. Do you have to have ultrasound? Do you have to have mammography? Do you have to have an MRI? I would also suggest that you go to places, radiology departments where they do a lot of screening, because like for any specialty, there is a learning curve for this exam, and we need people that would read your MRI or your mammography or your ultrasound to be very used to these kinds of exams and to interpret them properly. So the risk of breast cancer I would share with you to prevent to have breast cancer are mainly about our environment and about lifestyle. So there are coming data now in very important scientific journals that say, for example, that the lack of vitamin D would be correlated to breast cancer. It is correlated to having breast cancer or developing breast cancer, but it's also correlated to the risk of relapse once we have treated one breast cancer. So I'm not saying that every one of us should go to the first pharmacy and get lots of vitamin D and start to take it. I'm just saying that we need to get tested for the level of vitamin D we have and to supplement ourselves if ever we are lacking vitamin D. Vitamin D is a vitamin we get also from the sun exposition. We are for now protecting ourselves from the sun because it's known that we would be at risk of melanoma or any skin cancer if we sunbathe a lot, but this makes us also at risk of not having enough vitamin D. So we can get supplements of vitamin D, but not anywhere, it needs to be done reasonably and according to the level of vitamin D that we can actually dose in our blood and see whether we are in lack or whether we are fine with vitamin D. So the second thing would be green tea. Green tea is something that has been noted to be protective for breast cancer, for other cancers too, but especially for breast cancer because of some flavonoid acids that are antioxidative. So I would suggest you, and really it's very easy to get green tea, and to have the idea is to have at least 2 cups of green tea or white tea, and to have enough antioxidative products in our body. So this is now quite known in quite nice publications and and scientific research. One thing that many Vietnamese patients ask me in consultation is about meat. Every single patient or family would come into consultation and would tell me, can I get beef meat? So the idea is not about the meat itself, it's about the fat that is with the meat. We know now, and we do have scientific data that shows that the fat associated to the red meat is a risk factor for breast cancer. So it's fine to eat meat, but we need to eat lean meat. Another thing also that has been shown in some scientific data is that whenever we are pregnant, and in order to protect our embryos and our future children, it's also quite protective to eat lean meat with low amounts of fat, and this would protect our children from having breast cancer. Another thing I would think of would be veggies. We really need to eat vegetables to avoid breast cancer, and this is something quite documented in scientific journals now about how helpful vegetables are to reduce breast cancer. So I would tell again, avoid alcohol and smoking, have vitamin D if you need, drink green tea, eat meat, but eat lean meat and get lots of vegetables. The last thing I can say, because you asked me to say as much details as possible, is about psychology. You know, and whenever I started doing oncology, many patients would come to my consultation and would ask me, doctor, I've been through hard times a few years ago, and now I just have breast cancer. Does that have a relationship? They would tell me, I had a very difficult time a few months ago, I got hired or I lost a child, and now I'm very stressful, and then afterwards I had breast cancer. Does that have a relation? We used to say no, it was just a coincidence. But for now we know that psychological trauma, that means sorrow, very hard moments, are really associated with a higher risk of breast cancer. So I would suggest you to express your emotions and try to get rid of all these negative vibes. Because this would help you get through life, but this most likely would avoid you to get any risks for breast cancer and other cancers. So we cannot avoid bad events in life. That's something that belongs to life, that's part of life. But what we can change is the way we cope with them. So being angry does not mean you are aggressive. You can express the self and say, I'm not happy, I'm angry, or I'm sad, or sit down, listen to good music, and talk with a good friend. This will make you get rid of the negative vibes, get further in life, and most likely, because it's the talk today, reduce your risk of breast cancer.
Cảm ơn những chia sẻ rất hữu ích của Dr. Basma. Emmi cũng có thêm 2 chia sẻ nữa dành cho các bạn để kết thúc video clip này, bởi vì là Emmi cũng đã đọc khá là nhiều những tài liệu, khá là nhiều sách về ung thư trong quá trình mà bố của Emmi chiến đấu với cả căn bệnh này. Thứ nhất đó là hãy ăn thật nhiều những thực phẩm có chứa omega 3, bởi vì là omega 3 là thành phần mà cấu tạo nên tế bào ở trong cơ thể của chúng ta, nên cực kỳ quan trọng giúp có thể sửa chữa và xây dựng lại những tế bào mà đã bị tổn thương. Omega 3 thì có rất là nhiều trong những thực phẩm, ví dụ như là trong một số các loại cá, rồi ở trong dầu hạt lanh, dầu ô liu, hoặc là trái bơ. Đấy là những thực phẩm mà chúng ta hoàn toàn có thể ăn hàng ngày, cho dù là chúng ta đã hay là chưa bị ung thư. Lưu ý thứ hai đó là chúng ta nên tập thể dục chăm chỉ mỗi ngày, bởi vì không có cách nào ngăn ngừa bệnh ung thư bằng là một cơ thể khỏe mạnh. Vì vậy tập thể dục không còn chỉ là để mà giữ dáng này, đẹp da này, mà bây giờ sẽ có một mục đích quan trọng hơn nữa, đó chính là ngăn ngừa bệnh tật, trong đó có ung thư. Và Emmi xin chúc mọi người luôn luôn có một cơ thể thật khỏe mạnh. Hẹn gặp lại mọi người trong những video tiếp theo, và bất kỳ một câu hỏi nào thì đừng quên comment ở phía dưới. Emmi cũng sẽ có thể chuyển những câu hỏi này đến cho Dr. Basma để trả lời cùng mọi người. Bye bye! Cảm ơn mọi người đã theo dõi.